If you are going on a Medicare, there are four main parts that you need to know about. They are parts A, B, C, and D. So in today's video, I'm going to break down these four main parts of Medicare so that you can understand how they work and what you need to do so that you don't accidentally make a big mistake when it comes to your Medicare enrollment. Medicare can be really confusing. There are so many different letters and parts of Medicare, and a lot of my clients tell me that they feel really overwhelmed when they are trying to understand it all. So the goal of this video today is to really simplify and quickly explain the four main parts to Medicare so that you will have a solid foundation of understanding how this stuff works when you are turning 65 or retiring or going on a Medicare for the first time. First, we're going to talk about Medicare Parts A and B. Now, these parts together are what we call traditional Medicare or original Medicare, because these were the two parts of Medicare that have been around since Medicare originated. Medicare Part A is your hospital insurance. So this is the part of Medicare that helps to cover inpatient hospital stays, skilled nursing facilities, as well as hospice and home health care. Part A is going to be premium free for most people that have been living and working in the United States for 10 years or 40 quarters, or for those that have a spouse that meets that criteria. It's important to know that Part A does not cover long-term care. So nursing home care that is considered custodial care is not covered by Medicare Part A. And it's also important to know that if you don't have any type of Medicare supplemental insurance coverage, then there are deductibles and co-insurance amounts that you are responsible for on Medicare Part A. And in 2023, the Medicare Part A deductible is $1,600 per 60-day benefit period. Now, the second part of original Medicare is Medicare Part B. Medicare Part B is considered your medical or your doctor coverage, and there are a whole slew of services that are covered by Medicare Part B, including doctor's office visits, physician's fees, things like diagnostic testing, ambulance services, preventative services, durable medical equipment, and even many non-self-administered medications are going to be covered by Medicare Part B. Medicare Part B is not premium free, which surprises many people when they are turning 65. So in 2023, the standard Part B premium is $164.90 per month, although it may be higher if you are considered a high income earner. Medicare Part B also has a deductible, which is $226 per calendar year. And after that deductible is met, Medicare Part B will pay 80% of your covered medical services, and you're responsible for the other 20%, again, if you don't have a supplemental insurance policy. In general, most people are eligible for original Medicare the first day of the month that they turn 65, although certain people under 65 with disabilities will also be eligible for Medicare. You typically have to enroll in Medicare Parts A and B within your 7-month initial enrollment period window in order to avoid penalties. And that window starts 3 months before the month you turn 65. It includes your 65th birth month, and it lasts up to 3 months after the month that you turn 65. However, it's important to know that if you are still working when you turn 65, then you typically can and should delay your Medicare enrollment, and you won't get penalized. As long as you're actively employed and you have health insurance through your employer, and your employer has 20 or more employees, then you can delay your Medicare enrollment. You don't have to enroll in Medicare when you turn 65. And you can sign up for Medicare at any time that you're actively employed up until you retire. You have up to 8 months also after you retire to enroll in Medicare without penalty using a special enrollment period. Now let's move on to Medicare Part C. Medicare Part C is also known as Medicare Advantage, and this is an optional part of Medicare that you may or may not be interested in enrolling in. Medicare Advantage plans are managed care plans, and they are offered by private insurance companies that contract with Medicare. These plans offer an alternative way to receive your original Medicare benefits. So instead of having traditional Medicare Medicare Parts A and B through the government, you now have a managed care plan, like an HMO or a PPO plan through a private insurance company. In order to enroll in a Medicare Advantage plan, you have to be enrolled in Medicare Parts A and B, and you have to continue to pay your Medicare Part B premium. Medicare Advantage plans will cover the same services that traditional Medicare Parts A and B covers, but they're allowed to set their own cost share requirements, their own copays and co-insurance amounts that you're responsible for these services. Being managed care plans, these plans generally work with a network of doctors. So there will be a set list of doctors, providers, hospitals that will take your plan. Many Medicare Advantage plans are $0 a month in most areas, and some include dental or vision or hearing benefits that are not covered by traditional Medicare. And many Medicare Advantage plans also include Part D prescription drug coverage rolled right into the plan as well. Speaking of prescription drug coverage, that brings us to the fourth part of Medicare that will cover Medicare Part D. Part D covers your prescription medications. Think the medications that you go pick up at the pharmacy. Part D is only provided by private insurance companies that are approved by the federal government. So you can either get Part D benefits through a standalone Medicare Part D drug plan with traditional Medicare, or through a Medicare Advantage plan that includes prescription drug coverage. Medicare Part D plans can vary on which medications they cover and how much you will pay for these covered medications. But even the least expensive Part D plans must cover most generic and brand name medications, and they must cover all or most of the medications in the following categories that you see listed on the screen right here. Part D plans also cover some vaccines like the shingles shot that are not covered by Medicare Part B. And if you're wondering what Part D plan is going to be the best for you, I have a couple videos that talk about just that. I'm going to link them in the description below as well as up here. And those go into more depth about how to find the best Part D plan to meet your needs. It's also important to know that if you delay your Medicare Part D enrollment and you don't have other creditable prescription drug coverage, then you could face a lifelong Part D late enrollment penalty. So even if you're taking no or very few medications, you typically want to enroll in at least an inexpensive Part D drug plan so that you can avoid those penalties. Now, when you're becoming eligible for Medicare, you're going to see lots of ads and different information about all kinds of Medicare plans that are available to you. And these plans are going to almost always fall into one of two categories: either Medicare supplement plans that work with your traditional Medicare benefits, or Medicare Advantage plans, Part C, like we just discussed. There are plenty of pros and cons to both of these plan options, and the type of plan that's going to be best for you is going to be based off of several different factors. If you haven't yet, I have a few videos comparing the pros and cons of Medicare Advantage and Medicare Supplement, so please watch those if you haven't done that yet. But really, one of the best things you can do for yourself is talk to a licensed independent Medicare insurance broker whom you can trust. A good broker will help you review all of the available plans and pricing in your area, but it's really important to also do your homework first before you talk to an independent insurance broker. Unfortunately, sadly, not all brokers are going to have your best interest at heart. So getting an education on how Medicare works and how different Medicare plans work is really important so that you don't make enrollment mistakes that could have huge consequences for you down the road. Of course, this is what my team and I do every day. We are licensed in 46 states. Our service is completely free of charge. We work with both Medicare Supplement and Medicare Advantage plans, so we offer an unbiased approach to helping you find the best coverage at the best price for your needs. Please go ahead and give us a call. We are here to help you. And if you liked this video, go ahead and subscribe to the channel. We share lots of Medicare content and information that hopefully you'll find helpful. You can leave any questions that you have for me in the comment section below. I love hearing what you have to say. I'd be happy to answer any questions that you have there. And of course, you can email or call my office at any time. Thank you so much for watching this video today, all about the 4 main parts of Medicare explained, and we'll see you soon. Speaking of Speaking of